Mark and Brian here from Fitness4Life PT. This is video number 3 about knee replacements. We did the bending and straightening. Now we need to do some more range of motion just by moving your knee as opposed to just holding it and stretching it.
And these exercises also are for stimulating the muscle. So because once you have surgery, and even with pain, it inhibits how your muscle works. So it makes it harder for that muscle to work. Any type of swelling you have in the knee inhibits that. The pain inhibits that. So the surgery itself will inhibit that muscle learning to fire. So a few exercises you start doing pre, which you'll also be doing post surgeries, okay? So first one, we want to learn or teach the muscle to fire without you consciously thinking about it. Because that's the way muscles work a lot of times, is that they react or they fire without conscious thought. So a good exercise that we use is, and he's going to stand sideways to you, but what he's going to do is stand in sideways position. He's going to lift his back heel, shift his weight to his front leg, then he's going to rock back and lift his front foot, shifting the weight on the back leg. So it's just like that. The exercise part comes in when he's shifting back and lifting that front foot. That's causing his left quad, in this example, to fire unconsciously. It's going to do that automatically. You don't have to try to make it work. So just rocking back and forth nice and easy.
So you're not trying to go as far as you can, right?
Correct.
So this is more for balance. If you have maybe some balance issues, maybe take a little slower on this at first. You can get a little unsteady rocking back and forth if you're not used to this. Have something nearby to hang on to, just to be safe, especially if you have balance issues.
And in a progression, to add to this, as you're going back, lift your arm up overhead. That will increase the intensity a little bit, but it's just very gentle exercise. Even if you're having pain, most people can tolerate this. So 10 reps of this, but again, always listening to your body what you can do. A couple other exercises to throw in. Sit in your chair, or if you've got a little bit of a bar stool or that, sit and do a leg extension. So this means bending and straightening your leg as high as you can go. Focus on now you're actively trying to fire that thigh muscle. Bringing it up, pause with it, back down, nice, slow and easy. This is going to work the thigh. Part 2, work the back side. You're going to lay on your stomach. You want your kneecap not pressing into the table or the bed which you're laying on. So if you're laying full length on the bed, put a towel roll here to hold your kneecap off, or you can slide your kneecap up off the edge of the bed, and then you're just bending your knee and taking your rear or your heel towards your rear. Now you may not be able to go very far, but you start working on this and getting that working.
Nice and slow on the way down, right?
Correct. And again, this is another way too that you can work on getting it straight. So as you're going down, breathe into it, let the tension ease off at the bottom position, pause for a second or two to let that pull on it. But these are 2 good exercises to start with in your way to getting your surgery. There's more things you can do, but these are a couple things to give you. Remember, it's more important to stay consistent, and a little bit goes a long way. So what we always recommend, less, but done more often throughout the day is better than a lot at one time being done for the day. Because this is retraining the system. So do it more often throughout the day, consistently up to your surgery. You'll have a better outcome afterwards. If you have further questions, contact
Brian or Mark?
No.
John Lennon at fitness4lifept.com.